April 18, 2025, in a move that has drawn sharp criticism from public health experts and political commentators alike. The Trump administration has redirected the U.S. government's official COVID-19 information website, COVID.gov, to a new page titled Lab Leak: The True Origins of COVID-19. This new landing page no longer provides the public with information on vaccines, testing, or treatment options, but instead focuses entirely on promoting the theory that the coronavirus originated from a laboratory accident in Wuhan, China. The redesigned site lays out a detailed argument that claims the virus's emergence in close proximity to the Wuhan Institute of Virology was not a coincidence. According to the page, several researchers at the lab were allegedly sick with symptoms similar to COVID-19 in late 2019, months before the virus was officially recognized as a global threat. The site further suggests that the genetic makeup of SARS-CoV-2 contains elements that some scientists believe are unlikely to have arisen through natural evolution alone. Supporters of this narrative argue that the Chinese government has repeatedly obstructed efforts by the international community to investigate the true origins of the virus. The page also alleges that top U.S. officials, including Dr. Anthony Fauci and President Joe Biden, suppressed early discussions about the lab leak theory in favor of the natural spillover explanation, allegedly for political and diplomatic reasons. The administration is presenting this redirection as part of a broader campaign to expose the truth and hold both foreign and domestic actors accountable. However, the move has been met with widespread concern among health professionals and former federal officials. Critics argue that the redirection not only promotes a highly contested theory but also eliminates a critical source of accessible public health information. COVID.gov had previously served as a trusted portal for Americans to find updated guidance on vaccinations, long COVID care, testing resources, and emergency services throughout the pandemic. Many scientists and health organizations remain firm in their belief that the most probable origin of the virus was a natural spillover from animals to humans, as has occurred with previous coronaviruses. They point to peer-reviewed research and investigations that have consistently supported this theory. The new page on COVID.gov, however, dismisses this consensus, highlighting instead a handful of dissenting voices and emphasizing gaps and uncertainties in the evidence for a natural origin. The U.S. intelligence community itself remains divided on the issue. While some agencies, such as the Department of Energy and the FBI, have expressed low to moderate confidence in the lab leak theory, others including the CIA and the National Intelligence Council, have either backed the natural origin theory or stated they are unable to reach a definitive conclusion. A 2024 report by the Office of the Director of National Intelligence underscored this ongoing division, emphasizing the lack of conclusive evidence for either hypothesis. The redirection is being seen by many as part of a broader trend within the current administration to reshape federal communication platforms in line with its political priorities. In recent months, several government websites have undergone changes that critics say downplay scientific consensus or remove references to topics such as climate change, racial equity, and gender identity. The COVID.gov shift represents the most high-profile example to date, with implications that reach beyond public health and into the realm of international relations and domestic governance. Advocates for transparency argue that all theories should be examined and debated openly. However, public health experts caution that replacing essential health services with politically charged content, especially on a federally maintained site, sets a dangerous precedent. They fear it may lead to further erosion of trust in science-based institutions and hinder future pandemic response efforts by promoting skepticism and confusion. Perhaps most concerning is the timing of the move. With long COVID cases still affecting millions of Americans and new variants periodically emerging, the need for accessible and accurate health information remains critical. By removing essential resources from a major public health portal, critics argue that the administration is prioritizing ideology over public safety, potentially putting lives at risk. The redirection of COVID.gov marks a striking shift in how the federal government is choosing to communicate with the public on matters of science and health. As the debate over the origins of COVID-19 continues, the decision to use an official platform to promote a single, controversial viewpoint is likely to remain a contentious issue in the months to come.